So today at IndianFolk, we'll be decoding the meaning of the term euthanasia for you. Now, what is euthanasia? Euthanasia means a gentle and easy death. It is used to refer to the killing of those who are incurably ill and in great pain or distress for the sake of those killed in order to spare them from suffering. Now, what are the different types of euthanasia? There are three types of euthanasia, each of which raises a distinctive ethical issue. Voluntary euthanasia. It refers to the euthanasia which is carried out on the request of the person killed. It can be compared to assisted suicide. Euthanasia can be voluntary even if a person is not able to indicate his wish to die right up to the last moment. For example, a person while in good health can express his decision to die if in future through accident or illness his mental faculties are destroyed and there is no reasonable hope of discovery. Involuntary euthanasia. Involuntary euthanasia is regarded as involuntary when the person killed is capable of consenting to her own death but does not do so either because she is not asked or because she is asked and chooses to go on living. Killing someone who has not consented to being killed can properly be regarded as euthanasia only when the motives for killing is the desire to prevent unbearable suffering on the part of the person killed. Now, non-voluntary euthanasia. If human being is not capable of understanding the choice between life and death, euthanasia would be neither voluntary or involuntary but non-voluntary. Those unable to give consent include incurably ill or severely disabled infants, people who through accidents, illness or old age have permanently lost the capacity of understanding the issue involved without having previously requested or rejected euthanasia in these circumstances. Now, what is the justifiability of euthanasia? There are three cases pertaining to the justifiability of euthanasia. First is the justifiability of non-voluntary euthanasia. The case of justifiability of non-voluntary euthanasia stems from the conflict between the obligation to protect the sanctity of human life and the goal of reducing suffering. For example, consider the life and death decisions for disabled infants. Infants are sentient beings who are neither rational nor self-conscious, hence killing them cannot be equal with killing normal human beings or any other self-conscious beings. Abnormalities in a child, depending on how serious they are, can become a threat to the happiness of the parents or any children that they may have in future. Now, consider the case of a spinal disease known as Spina Bifida, which in severe cases leads to permanent paralysis of the body and causes intellectual disabilities. The affected children need repeated major surgery to prevent the curvature of the spine, which makes the life miserable. In such cases, the view of utilitarianism entails that if there are no extrinsic reasons for keeping the infant alive, like the feelings of the parents, it is better that the child should be helped to die without further suffering. The counter-argument here is that of hemophilia. A clotting disorder commonly known as hemophilia makes the life of a child difficult, still worth living. In this case, the argument of euthanasia seems to be invalid as it would deprive him of the positive balances of happiness over misery. However, considering the total version of utilitarianism here would lead to a difficult conclusion. The death of a disabled infant may lead to a birth of another infant with better prospects of a happy life. Hence, the total amount of happiness will be greater if the disabled infant is killed. Hence, the replaceability argument justifies the euthanasia to hemophilic infant. Euthanasia is also justified in the case of other human beings who have lost their rationality and self-consciousness. If such beings experience less pressure, then it is difficult to see the point of keeping them alive. Example of the patients in comatose. Here, it is considered better to end the life of the individual as his life has no intrinsic value left. Consider the case of justifiability of voluntary euthanasia. Voluntary euthanasia is justified on the following grounds. The argument of preference favors it, as an individual with good cause may end his life if it has become drawn out or depressing. Just as preference utilitarianism counts a desire to go on living as a reason against killing, it must also count a desire to die as a reason for killing. The principle of respect for dichotomy and individual right allows that a rational agent's choices should be respected. Hence, respect for an individual's autonomy will lead us to assist them to do as they choose. Hence, voluntary euthanasia is acceptable only on the following grounds. The patient is well informed, free from external pressure, and has explicitly requested euthanasia in a manner that leaves no doubt to the parents of the patient's wish to die. The patient has an irreversible condition that has no reasonable alternative, and it is carried out by a physician who has consulted another professional who agrees with his judgment. Now, consider the case of the justifiability of involuntary euthanasia. Involuntary euthanasia is valid only when one can judge when a person's life is so bad so as to be not worth living better than the person can judge himself. We are unlikely to encounter the case of justifiable involuntary euthanasia as we do not have confidence in the judgment about whether the life of another person is worth living. Now, what is active and passive euthanasia, and what is the doctrine of acts and omissions? The doctrine of acts and omissions hold that there is an important moral distinction between performing an act that has certain consequences and omitting to do something that has the same consequences. Allowing a person to die to end his suffering is called passive euthanasia, and killing him for the same is called active euthanasia. Example, consider the case of handling a disease like baby dough which leads to serious defects in the esophageal tract. In this case, a doctor has two possibilities. In first case, the doctor might administer a lethal dose of drug to end the suffering of the baby on the request of the parents, or he might contemplate on the dangers of surgery and refuse permission to do so. The consequences are both the same, but the ethical judge, who is the doctor here, weighs on the moral distinction between the acts and omission and chooses accordingly. Now, what is the slippery slope argument in euthanasia? Euthanasia is the first step down the slippery slope. In the absence of prominent moral footholds, the society would slide down into the abyss of state terror and mass murder. For example, in Nazi Germany, the so-called euthanasia program was the root cause of all the horrendous crimes that the Nazis committed, because the program implied that there is such thing as life not worthy to be lived. Their so-called euthanasia program was not motivated by concern for the suffering of those killed. If it was so, the Nazis would not have kept their operation secret and would not have made racial origin and ability to work as the basis of selection of patients to be killed. Hence, Nazi euthanasia was never voluntary and often was involuntary rather than non-voluntary. The slippery slope argument could be defined as a way of suggesting that present strict rule against the direct killing of innocent human beings serves a useful purpose. Now, with this, we come to the end of our video. If you liked the video, do share it and do subscribe to our channel, Indian Folk.